I was intrigued by neonatology as a medical student. I found it fascinating that a baby could be born and weigh as little as a pound, but then also over 10 pounds. Where else in medicine can you see a 10-fold size difference in your patients? Sometimes they're healthy, and sometimes they can be very sick. It was amazing how fragile they were, but also how resilient they could be. I think it was the complexity of patients and still what was left to be discovered in the field of neonatology that really drew me to it. The development of a baby is complex, and even after birth, they still have a long way to go. Also, we have to remember that we're not only taking care of the baby, but also the entire family. That is what makes neonatology so difficult. The families are entrusting us, the neonatal care team, with their most valuable gift, their newborn baby. I think we all go through our challenges every day, and some we win and some we lose. Whether they are big or small, most of our daily challenges are usually not as bad as when we think when we put that into perspective. When I walk into the neonatal intensive care unit, I put my daily struggles aside because it is very different in the NICU. Every day, there's a baby struggling to breathe, fighting against a life-threatening infection, trying to adapt physiologically to life outside of the womb, needing medications or machines to help them improve, in countless other situations, which create a delicate balance between a good outcome and a bad. And that really puts things into perspective. I usually start my day around 7 a.m. and I examine all of my babies in the NICU. I also review the laboratory results and any radiology tests that we have ordered from the day before. By 8 o'clock, a few parents may start coming in to feed their babies, and I try and update them with what happened overnight to their babies. By 9 o'clock, we usually start rounds with the nurse practitioners and the rest of the team, and we talk about each baby. We make plans for what will happen to them from starting or stopping medications, adjusting their feedings, maybe doing surgical procedures, or even hopefully going home. By 11 o'clock, it's feeding time again, and more parents come in. We then try and talk to them and give them updates. Thereafter, if there are any major changes that we did for a baby, we go back and we check on them and see how they're handling the change. We also periodically check in with our OB-GYNs in labor and delivery and see how their day is going. Is there someone in labor that may need our help? And if so, I go and talk to those families before the delivery to let them know what to expect. The rest of the day is always fun and entertaining. It is composed of writing notes, talking to parents, helping stabilize admissions or sick babies that are already there, and just following up with the staff to make sure there have been no unexpected changes. My day usually slows down after about 6 p.m. when most of the deliveries happen from the day and we get to catch our breaths. But sometimes it can extend into the night as a sick baby does not make an appointment. Neonatology is a very young field in that even the word neonatology has only been around for 65 years. Neonatal care has evolved much quicker, however. We have been studying babies and how to take care of them for much longer, but it took a while for the science to catch up. The hardest part at first was trying to figure out how to run tests without needing the same amount of blood that an adult needed. Back in 1960, a 2-pound baby had a mortality risk of 95%, so only about 5% or 1 out of 20 babies would survive. By 2000, in only 40 years, that same 2-pound baby had a 95% chance of survival. So 19 out of 20 of those babies would make it. This is all due to the dedication of countless physicians and researchers who are always working to provide better ways to take care of babies. The research is always ongoing and always fascinating. The late Dr. Alistair Phillip said it best. As neonatologists, we owe an enormous debt to our predecessors, but we are still faced with many challenges for the future. Perhaps the most important of all would be a better understanding of how to prevent prematurity. The best 3 words I can think of are strength, dedication, and patience. The 3 words do not all apply just to me, but rather to everyone in the NICU. Strength is first and foremost, and it comes actually from the parents and their babies. If a baby's coming to the NICU for an admission, something is obviously wrong. There is a reason that that baby must be there, and that creates uncertainty and fear. My job is to calm that fear and provide the families the confidence in my team's ability to help their baby. My job is to show them that not only is it okay to be nervous, but that they have an inner strength that they will need to hold on to get through their time in the NICU. If I can help the parents through this and also provide the medical support the baby needs to fight through the illness, then I think we can be successful. Dedication is second, and that comes from the entire team in the NICU. From the doctors, the neonatal nurse practitioners, the nursing staff, the respiratory therapist, lactation consultants, and other members, we all work as a dedicated team. We all go through special education and certifications to earn the privilege to be able to take care of someone else's sick child. It is a trust and a privilege that we should not take lightly. Patience is the last. Patience is something I tell all of my parents about when they first come into the NICU. Being a parent of 2 kids myself, my kids taught me to be very patient. However, taking care of a sick baby, sometimes seeing little progress, or what I like to call baby steps, a NICU baby really can teach every one of us about patience. Oftentimes, a baby can stay several months in the NICU. Imagine having to drive to your local hospital every day because you could not take your baby home after delivery, but rather having to visit during those several months. Imagine having to watch your baby grow a 1/4 of an ounce or 1/2 an ounce a day at a time, from 1 pound at birth to maybe 6 or 7 pounds before they go home. That is a level of patience most people never experience, but it completely changes your perspective on life. Patience is a virtue after all.